For a week, the world celebrated and honored nurses for their bravery and commitment to excellence in patient care, reaffirming the value of nurses as the backbone of Nigerian healthcare system. Well, as the year goes by, nurses in Nigeria are still demanding better remuneration and welfare. Another issue is the constant exclusion from the policy-making bodies in the health sector. And with this in mind, our correspondent Sarah Ayeku had a chat with some nurses in Lagos.
According to the International Council of Nursing, nurses make up the largest proportion of the health workforce, comprising 90% of the contacts between patients and health professionals. They are integral at all levels of the health system, from primary care, population health, specialized services, and policy and management. Yearly, nurses have weathered different public health emergencies, the most recent, the COVID-19 pandemic. These health workers are in the front line during any disease outbreak, contributing to research, disease prevention, treating the injured, and administering care. In the context of the global COVID-19 health emergency, which has highlighted the depth of the nursing shortage in Africa and globally, the WHO says Africa has long grappled with a severe shortage of nurses, which, if left unaddressed, poses a significant threat to the continent's progress towards universal health coverage. Every year, the world carves out a week to commemorate the International Nurses Week. This year's theme, Nurses, a Voice to Lead, Invest in Nursing and Respect Rights to Secure Global Health, could not be more appropriate. To celebrate one out of many unsung heroes in the Orile Agege General Hospital in Lagos, I met a nurse who has committed about 40 years of her life to serving humanity. She is Mrs. Bose Oshisami, an apex nurse poised to change how residents in Lagos perceive nurses. She talks about what inspired her to become one.
When I was in secondary school, when I see nurses dressed in white with their immaculate uniform, I just say, I want to be a nurse. I want to be a nurse. So when I finished my school start, I sat for nursing exams, and fortunately I was admitted. I went to SDA School of Nursing, Ife, between 1981 and 1984. You know, nursing is a noble profession, and you give to humanity. Well, what I want to be remembered for is my selfless service in nursing.
Gleefully talking about the changes she has seen in the health sector in Lagos, she's worried about the brain drain of health workers.
Nurses, you find out that when you invest in them, you find out that they are more encouraged. Because brain drain is more than we see. Oh. Look at a nurse that is earning maybe 200 there, and they now say, come over there with your child, with your husband, and we'll be paying you by 1 million. That person will not want to stay. And I will not say that unless the government can pay us 1 million, will they be able to do it? The government are trying. Because I see nursing, I'm going to leave nursing better than I met it. And remember, early this year, the nurses went on strike. And Governor Sanwo-Olu was very swift in answering us. You know, that's an encouragement.
Taking off the monocolored uniform they wear daily, nurses at the Orile Agege General Hospital took time to celebrate their success stories while honoring outstanding nurses in the hospital.
They deserve to be celebrated every week, for the work they do, for their vestedness, for their conscientiousness, for how well they go out of their way to care for patients. It takes being a special person with a special heart to be a nurse and to work in any hospital anywhere, not to talk of in developing country environment like ours. Or lab scientists or pharmacists can't do their work alone without the nurses being the ones to actually carry them out. So my appeal to government, society as well, and hospital too, in that order, will be that, first of all, for the government to continue to try to invest in their capacity development. Lagos State is doing a lot. but I also believe that they can do more.
The Association of Nigerian Nurses and Midwives reports that in the last 3 years, more than 11,000 nurses have migrated to developed countries.
I'd like to plead with the government to please increase the remuneration of nurses. Let us be encouraged with payment first, because we all know that things are highly expensive everywhere now. Things we do get for 15 naira is now going for 1,000 naira. And we are still based on the same salary we have been since years past. So we need increments and we need more hands. Government should please endeavor to employ more hands. They are trying. Lagos State government is trying. Most especially Lagos State government is trying to increase manpower, but we still need more. We will always ask for more. We still need more. So also we will need the government to please involve nurses in policy making. We need nurses to be there, to be at the top. Not only doctors that can man or manage an hospital. It's not only doctors that can man or manage a ministry. Nurses too can do that.
We have nurses who are PhD holders. We have nurses who are intelligent. Gone are the days where we have Gallipot nurses, but now we have polyvalent nurses. We have nurses who are up to date. And when I say up to date, I mean being up to date in their standard of practice. Well, where do we find ourselves? Where do we find ourselves? We found ourselves being shut down. We found ourselves being treated like a second-class citizen. And nurses are not supposed to be like that. They are not supposed to be treated like that, because we are the heart of the hospital.
The grim reality of how burdened these health workers are become glaring at times when a patient visits most general hospitals in Lagos. A narrative nurses are trying to change.
We are scientific. We are nurses. We know what we are doing. We are nurses. We can prescribe. We love Nigeria. Not that we don't love Nigeria, but things we are experiencing in Nigeria, especially some units, when you go to some general hospitals or even private hospitals, the nurses, the doctors, they are being, abused by the patient. There should be a law that will back this up. We shouldn't be abused. We shouldn't be, we should be treated equally. And we have nurses everywhere has changed. The behavior of nurses towards patients, towards relatives have changed.
For most of the nurses, it is discouraging to see their colleagues who took the option of leaving Nigeria to work as healthcare providers live better lives, while the situation in the country remains unchanged.
Who wants to be a third-class citizen in another man's land? But because we are not well remunerated, we are not treated well, they don't give us that voice to talk. And you find out that so many nurses are finding their way alternative to go out of the country. And I feel the government should do something about it, because if everyone leaves this country, there'll be a lot of brain drain, there'll be a lot of problems to the health sector in the country at large. So we are imploring that the government should come and do what they can do in terms of salary, in terms of remuneration, in terms of so many things.
Professionals like Mrs. Oshisami has been through a lot, sometimes crying through difficult times. At other times, the cases she has attended to caused some unpleasant behavioral change.
And we had one patient, do you know, for about 6 months I was not eating rice because the maggot that was coming out from that patient's leg was like rice. So I could
When I heard that, I cringed, picturing myself in a position as a nurse. How will I do without rice for 6 months?
There's nobody that can pay you for what you do. It's only God that can pay you for what you do. It's not easy. Some people cannot stand the vomit of their child or of their nurses will carry bowl. Pull there and do all sorts of things. So when you are coming into nursing, have that in mind, that you are going to do dirty jobs. And there's nobody that can pay you for that dirty job. So just go because you love the profession.
Mrs. Oshisami wants nurses to be remembered as people who gave their all to humanity. Sarah Ayeku, TVC News, Lagos.